Welcome to Organizational Wellness from the Top, Stress Mitigation and Work Satisfaction for Healthcare Providers. This webinar is part of a series of modules sponsored by the U.S. Department of Health and Human Services Office of the Assistant Secretary for Preparedness and Response, or ASPR's Technical Resources Assistance Center and Information Exchange, or TRACIE. ASPR TRACIE works closely with healthcare facilities, coalitions, ASPR recovery staff, and HPP partners across the country and has repeatedly heard from disaster-affected communities that disaster behavioral health recovery has been challenging for the healthcare providers involved in recent natural disasters and no-notice events. Each of the modules we've developed includes a micro-learning module and a longer webinar. The three topics are 1. Addressing compassion fatigue and behavioral health needs for healthcare providers. 2. Organizational behavioral health and wellness for executive-level healthcare facility staff. And 3. Healthcare provider cognitive strengthening preparedness program. ASPR TRACIE launched on September 30th, 2015. The development and functionality of ASPR TRACIE are collaborative, involving multiple HHS operating divisions and other federal government departments and agencies, local, state, and regional government agencies, national associations, nonprofit organizations, and private sector partners. TRACIE is comprised of 3 domains: technical resources, which houses our resource library and subject matter expert reviewed topic collections; the Assistance Center, where users can receive personalized support and responses to requests for information and technical assistance; and the Information Exchange, an area for password-protected discussion among vetted users in near real time. ASPR TRACIE has also developed several resources specific to disaster behavioral health. These are housed in our Select Disaster Behavioral Health Resources page. Now, I'll turn it over to Dr. April Natural, who developed and will lead all of these modules.
Do a lot of your employees call in sick? Have you noticed a dip in morale or a spike in turnover? Your staff may be just surviving, not thriving. They may be suffering from compassion fatigue, secondary traumatic stress, or worse. But that doesn't have to be the case. Hello, and welcome to this preview of the ASPR TRACIE webinar on organizational wellness and job satisfaction for healthcare professionals. My name is Dr. April Natural, and I'm a traumatic stress specialist who provides disaster and emergency preparedness and response consultation to responders and community members. This module is geared towards healthcare executive-level managers, administrators, and supervisors who create the environment, the culture under which staff members work for the over 2,000 hours that most will put into your organization this year. What is organizational wellness? There are many dimensions of wellness. Various programs that exist in workplace organizations usually focus primarily on the physical health of their staff, such as nutrition and exercise programs, smoking cessation, and disease prevention and management. These programs are usually offered to employees as a part of their workplace benefits and are carried out in the personal lives of those who decide to participate. The comprehensive webinar on this topic focuses on the behavioral health aspects of organizational wellness, including emotional well-being, mental health, and mental illness and substance abuse. The old adage that the organization's culture is created from the top down still stands. What's the culture of management in your healthcare organization? Are you a people manager or a task manager? Do you foster competition or collaboration? Do you focus on improving weaknesses or in developing strengths? Have you ever looked at these serious questions as a manager or as an organization other than through a standard staff satisfaction survey? Most of those don't get to the heart of these issues. If you haven't asked these questions, the time is now. A study from Beth Israel Deaconess Medical Center informs us that while stress may be a factor in 60 to 80% of all visits to primary care physicians, only 3% of patients actually receive stress management counseling. What this really says to us is that if we're not teaching or recommending stress management to our patients, we're likely not practicing it either. This webinar will teach you about your role as an influencer and how important it is to model organizational wellness. You'll learn about compassion fatigue, secondary traumatic stress, and other behavioral health issues and how they can affect organizational wellness. We will show you how to implement a wellness program, and we'll share tools and other resources you can use in the process. There are many resources that can inform you further about acute stress, post-traumatic stress, secondary traumatic stress, compassion fatigue, and burnout. Both ASPR TRACIE and SAMHSA DTAC have a wealth of information and fact sheets, as well as webinars and podcasts that address various topics for different audiences, like responders and parents, for example. For those of you seeking research and peer-reviewed articles, the National Center for PTSD's website will bring you to the PILOTS database, which is the most comprehensive collection of literature on these subjects. Registration in the PILOTS database and access to the articles that it houses is free, and most of the materials are downloadable. Access the full training on this subject today and find out how you can keep your healthcare organization and yourself as healthy as possible. Please reach out to us if you need technical assistance. Thank you.
Produced using taxpayer funding by the U.S. Department of Health and Human Services.